the simulation suite really enhances the learning of our speech and language therapy students. It gives them a great opportunity to practice their skills and clinical skills in an environment which is really safe and enables them to develop confidence before they're going out on their external clinical placements.
I think performing the orofacial assessment in the clinical suite was really interesting because it gets you used to being in sort of a clinic room. Like for me, I've never been sort of that side of the room. I've always been on the other side as a patient. So it's quite nice to get used to sort of delivering that information and how you should be in that sort of situation and yeah, getting you ready professionally.
The thing I found most valuable about the feeding practical session was probably the practicing of equipment. Using the beds was really helpful, getting to understand what the different buttons do and the importance of hygiene and our positioning when feeding people. And it was really great to have an insight into what it would be like out on a ward to prepare for placements and when we graduate.
This exercise will be really helpful in my future career as an SLT. It's given me more of an understanding about what our clients and our patients feel like. Being fed is quite a personal and sometimes invasive thing to have done to you, so experiencing what that feels like so that we can help them and support them in the best way and make it a better experience for them.
What I appreciate about having a dedicated simulation suite as an SLT student is that I think, especially as a person with a lot of anxiety, it provides me sort of like a safety net before I actually do the real thing. I think that we've gotten a lot of support from the clinical tutors that we've had in placement, and so it's let me sort of be in a space where I can make mistakes before the real thing, I guess, and it's sort of helping me gauge the reality of how I'm going to be doing the assessments with these patients, and the role playing has been so helpful to me as well because I've been really anticipating communicating with adults since my pediatric year.
I think the sessions help me feel prepared because it's a good environment to make mistakes and learn for them, which you'd rather do before than after. And making those mistakes earlier means that when they might happen later, you know how to bounce back from them easier.